Welcome to this episode of Family Practice. I'm Dr. Jeff Fox. March is Colon Cancer Awareness Month, and we're going to talk diagnosis and treatment. And when's the last time you had your blood pressure checked? We're going to tell you why. Also, Central Kentucky has a new mental health treatment option, and Glean, Kentucky is here. To start me off is Dr. Jennifer Ray and Dr. Frank Rutigliano, and I know you guys as the CSGA, and I'm going to try to get this right, Colorectal Surgical and Gastroenterology Associates.
Nailed it.
Right?
Nailed it.
Yeah. Well, you know, I said Colon Cancer Awareness Month. We're going to do some true-false, okay? Some questions. And the first one up, then we'll put the graphic up, is colorectal cancer is the second leading cancer.
That's right. The incidence has been the second leading cause of cancers in the U.S. and also the second leading cause of cancer deaths in the U.S. for quite some time. And Kentucky has the highest rates of colon cancer in the nation. Okay. 2024 facts might be third because of the great job we're doing with prevention, but well, right up there.
Second or third, you say it's high. And Dr. Rutigliano, right. We're seeing a lot more young people than we did before.
That's right. Our general trends are to see a drop in the amount of colon cancer in people from 55 to 75, and we equate most of that with the success of screening and preventative colonoscopies. However, in folks under the age of 55, we've only seen an increase in the rate of colon cancer, and specifically rectal cancer, every year.
So it's not necessarily now an old people's disease.
That's correct.
Okay. The second question is, colon cancer often starts with no symptoms.
Yeah, that is absolutely true. So majority of colon cancer diagnoses are folks who have no symptoms at all. There's certainly worrisome symptoms that prompt evaluation. So any rectal bleeding, significant abdominal pain, or change in your bowel habits warrant being examined.
Okay. Dr. Ray, as a female physician, you can also have symptoms, uterus, ovaries, colon, that you need to pay attention to.
Absolutely, and that's really the take-home message that we'd like the viewers to really hear tonight, is that young patients can have colon cancer too. We're seeing it more and more. And so, a common presentation would be a young female with small children who's constipated, thinks their hemorrhoids are flaring up, that's why they're bleeding, they're fatigued, not sleeping well. Those patients are really indicated for colonoscopy now, more important than ever. Well,
Dr. Rutigliano, she mentioned colonoscopy. That's one of the prevention, and we talk prevention and treatment. Right. And there's a difference between colonoscopy and some stool testing. Tell us what you do and when you do it.
Right. So for colonoscopies, the age now is at 45 for asymptomatic people that are average risk. So if your first degree relative doesn't have any colon cancer or advanced polyps, then you would fall into that risk to start a colonoscopy at age 45. It's really those folks that have symptoms, bleeding, that need evaluation sooner than that. There are other options outside of colonoscopy. These are a screening tool, such as the Cologuard or a fecal occult test, where you send off a piece of stool. Those can raise suspicion for polyps or cancers, but they do have a false positive and a false negative rate, where you could have cancer or polyps and have a negative test.
Okay, now you mentioned the stool test, and if you got a positive stool test, Dr. Ray, you're going to end up with a colonoscopy anyway. But the colonoscopy could actually treat the problem at the time?
Yes. Colonoscopy will find nearly 100% of all colon cancers, but we don't want to be finding cancers. We want to be finding the growths called polyps that are precancerous. And when we remove those during colonoscopy, we prevent cancer and deaths from colon cancer. And that's really the target of the screening program.
So if you're talking screening, you're also talking treatment and prevention for a could be deadly disease.
Absolutely.
Correct. We thank you guys for coming in. We thank you for all you do. We thank you for the care that you give our patients, and we appreciate it.
Well, thank
you so much.
Thank you.
So if you haven't had your colonoscopy or having symptoms, make sure that you get it done.